Welcome to the UMCC Medical Consultant Connector. We're here to help you make informed choices about your health and safety, starting right at home. Today, we're shining a light on the hidden dangers that might be lurking in your medicine cabinet, dangers that many people overlook in their daily routines. Medicines are designed to help us feel better and recover from illness, but when they're not used as directed, they can quickly become dangerous, even deadly. Misuse, whether accidental or intentional, can turn helpful remedies into harmful poisons, sometimes with life-threatening consequences. In this chapter, we'll explore two major risks: drug poisoning, which can affect anyone regardless of age, and teratogens, substances that can harm unborn babies during pregnancy, often without obvious warning signs. Everyday items like painkillers, cough syrups, and even vitamins are generally safe when used as intended. But if they're misused, taken in the wrong dose, or accessed by children, they can become extremely dangerous. Accidental poisoning is a real and serious risk, especially for curious kids who don't yet understand the dangers of colorful pills or sweet-tasting syrups. Even common drugs like paracetamol, which many people use for headaches or fevers, can cause severe liver damage or even death if taken in large amounts or overdosed. Iron tablets, often used for anemia, are especially toxic to children and can be fatal if swallowed in just a few doses. It's important to remember that over-the-counter drugs and even household products can be just as hazardous as prescription medications if they're not stored or used properly. Understanding these risks and learning how to prevent accidents is the first step to keeping your family safe and healthy. We'll guide you through practical tips and essential knowledge to help you protect your loved ones and keep your home safe. Let's get started on this important journey together. How do you know if someone's been poisoned? Recognizing the signs early can make all the difference in an emergency. Drug poisoning can happen to anyone, anywhere, and often the symptoms appear suddenly and unexpectedly. Symptoms vary depending on the drug involved, but vigilance is key. Being alert to even subtle changes in a person's condition can help you act quickly. Watch for sudden drowsiness, confusion, nausea, vomiting, or abdominal pain. These symptoms may develop rapidly and can worsen if not addressed. Physical signs like burns around the mouth, unusual pupil size, or trembling hands are red flags that should never be ignored. Breathing changes, whether too slow, too fast, or labored, can signal serious trouble and may indicate the body is struggling to cope. Seizures or loss of consciousness require immediate action. These are medical emergencies that need urgent professional help. For example, paracetamol overdose may start with mild symptoms like nausea or stomach pain, but can cause severe internal damage to the liver if not treated quickly. Sedatives can cause extreme sleepiness and dangerously slow breathing. Stimulants may cause agitation, tremors, and a racing heart. Each drug type has its own warning signs. Trust your instincts. If someone suddenly becomes unwell and you suspect poisoning, act fast. Don't wait for all symptoms to appear. Look for clues. Open containers, spills, missing pills, or strange smells in the room can all point to possible poisoning. Quick recognition and immediate action can save a life. When in doubt, seek medical help right away. Every second counts. If you suspect someone has been poisoned, it's crucial to act quickly, but also to remain as calm as possible. Panic can make the situation worse, so take a deep breath and focus on what needs to be done. First, make sure the area is safe for both you and the affected person. Remove any dangerous substances or potential hazards from the immediate environment to prevent further harm. Next, check if the person is conscious and breathing. Gently try to wake them and look for signs of normal breathing or movement. If the person is unconscious but still breathing, carefully place them in the recovery position. This helps keep their airway open and reduces the risk of choking, especially if they vomit. Call emergency services immediately. Don't wait or try to handle things on your own. Time is critical in poisoning cases. When you call, be prepared to provide important details: the person's age, what substance they may have taken, how much, and when the exposure happened. This information helps professionals respond quickly and appropriately. Keep the container, packaging, or any labels nearby for reference. This can help medical responders identify the poison and choose the right treatment. Do not induce vomiting or give the person anything to eat or drink unless a medical professional specifically tells you to do so. Some substances can cause more harm if vomited or mixed with food or water. Stay with the person at all times. Offer reassurance, keep them calm, and closely monitor their condition until help arrives. Your presence can make a big difference. Collect any evidence, such as pill bottles, packaging, or even vomit samples, and keep them for the medical team. These items can provide vital clues for treatment. Remember, your quick and clear response is the first and most important link in the chain of survival during a poisoning emergency. Always call for help. Never try to manage a poisoning situation alone. Professional assistance is essential for the best possible outcome. Now let's talk about teratogens, agents that can harm a developing baby during pregnancy. These include certain drugs, chemicals, and infections. The first trimester is especially critical, as major organs are forming. Exposure to teratogens at the wrong time can cause birth defects. Notorious examples include thalidomide and some acne or epilepsy medications. Not all medicines are dangerous, but always consult your doctor before taking anything during pregnancy. Sometimes treating the mother's illness is more important than the risk of medication, but only a healthcare professional can help you decide. Never start or stop medication in pregnancy without medical advice. The key to safety is respect and caution with all medicines. Always read and follow label instructions. Never guess dosages. Store all medicines, vitamins, and supplements out of children's reach, ideally locked away. Never call medicine candy or leave it where kids can find it. If you're pregnant or breastfeeding, consult your doctor before taking any medication, including over-the-counter or herbal remedies. Proactive communication with your healthcare team ensures the safest treatment. Thank you for joining us at UMCC Medical Consultant Connector. Share this video to help others stay safe. Stay informed, stay safe, and see you next time.